Hello everybody and welcome to this second update that I'm doing on the coronavirus outbreak that is now causing a pandemic across the world. We're going to discuss three topics in this video. Number one, update of the current situation across the world. Number two, we're discussing the first documented case in South Africa. And number three, a recap on preparation and what you can do in your own home, in your own work environment, and in your own community. Okay, so let's start. At the moment, we've got documented 97,878 cases across the world. Deaths, 3,353. Recovered patients, 54,122. Countries at the moment, 87. And South Africa today, on the 5th of March, has had its first patient. We'll get to that a little bit later. Then again, just to recap the clinical features, the patients get a high fever, 98% of the patients. It is a lower respiratory tract disease, which means it's not the normal common cold, runny nose, blocked up sinuses. It's definitely a dry cough, slight sore throat maybe, then dry cough, chest irritation with a high fever. And as it progresses, it can become a situation where you find it a little bit difficult to breathe. That's why dyspnea, which means shortness of breath or difficulty in breathing, occurs in 55% of cases. Body aches and pains and headaches are also other symptoms, but they are not the predominant symptoms that you would find with this coronavirus. Okay, let's get to the case that we've had in South Africa. It's confirmed by the health department today that a 38-year-old male from KwaZulu-Natal returned from Italy with his wife on the 1st of March. There were 10 people in their party. This male person got ill 2 days later on the 3rd of March. He went to seek medical help and he was evaluated and isolated and eventually tested as well, and these results came back on the morning of the 5th that it was a positive coronavirus infection. His wife obviously had close contact. They've also got 2 children, and they are isolated and keeping away from other people. You need to do a test, which is a nasal swab and a throat swab that you take a little bit at the back of the throat and back of the nose, and you get those results. If the results are negative, the person needs to be tested again in 24 hours before they can come out of isolation or quarantine. So that's very important to know, that you've got to be tested again if you were negative, if you qualify to be tested. That's also important. We cannot test every single person. If you've got no temperature, you're not going to be tested. So looking at criteria, a fever, temperature above 38 degrees, contact history, which means you've either been traveling to a country where there were a coronavirus outbreak, or you had contact with someone that traveled, or you knew someone that traveled that maybe had contact with you. So that's very important to have that history, especially in the containment phase. Remember, we are now in the containment phase, not in an epidemic phase. In South Africa, we don't have an epidemic yet, so we don't have hundreds and hundreds of patients that are ill. We've got a few, and we are trying to contain the virus. Again, the temperatures are warmer in South Africa at the moment, which is to our advantage. The virus does not survive on surfaces that long if the temperature is dry and warm, other than the southern hemisphere, which have got a winter cold temperature situation. So it helps that the temperatures are a little bit warmer in our area at the moment. And also remember, it's droplet spread, not airborne, which means it spreads by sneezing or coughing over a short distance, meter and a half. It's not going to spread through a whole room. So that's very important. I think the most important thing that we need to remember the way it spreads is contact and hands. So please, if you do sneeze and cough in your forearm, not in your hand, and try and stay away from your own face. Don't put your hands close to your mouth or your nose or your eyes, because that's also how the virus is going to spread. So those things are important to know. They're keeping a very close eye. They've got a team there to see what's going to happen. They're screening all the contacts, all the possible people that were involved. But you must remember that there are other people returning from Europe or places across the globe that have had the coronavirus. So we can get new cases through our airports in different cities. So I think the important thing is, wherever you are, you need to be careful and just take the basic precautions. Practical things that you can do at home. You know, we've got a nice little alcohol spray canister by the front door, and anyone that comes into the house, let them just quickly spray their hands and make sure that it's clean, and then come into your house. It's just a good practical thing. I flew to Johannesburg 2 days ago, and I just took a little hand sanitizer spray with me. So that's a really good thing. You know, you can just use it to spray on your hands like that, both sides. Rub it across your hands. It doesn't taste very nice, so it's good. You're not going to put your fingers in your mouth. Also spray the contact areas where you're going to sit, the rails, the button that you turn to actually get the tray down. Those high contact areas are actually good to just spray. Try to avoid door handles and things like that in big public areas. And that way we can really contain the virus and limit the spread. So it's important to realize that 96-97% of cases get completely well after this viral infection. The biggest challenge is going to be the inconvenience of having to be at home for 2 weeks. That's our biggest challenge. Also, our older patients, 70 and higher, definitely are more at risk of developing serious disease. And in a future video, what I will do is discuss the way the coronavirus actually causes fatality. It's done through a condition called ARDS, Adult Respiratory Distress Syndrome, and it affects the lungs and it makes it very difficult for you to properly get oxygen into your body. And that requires ventilation in ICU, and that's where the people that have got underlying lung conditions, heavy smokers, TB patients, they are really going to struggle with that if they do get the coronavirus. And then, as I said, also our older patients. So that will be in a follow-up video, and also to see where the numbers are going. But I think the important thing is be wise, don't panic, you know, do the right thing, don't do unnecessary things to spread the virus, and give other people information. Spread this video, like it, share it on YouTube so that more people can see what it's about and get the right facts, and we can actually really work together as a country to limit the damage that it's going to cause to our people and also to our economy. Thank you for listening, and remember, knowledge is power, and stay healthy.